I am Glenn Preminger from Duke University, and I'm truly honored to give the 2021 Lattimer Lecture, where I will talk about the future directions in medical stone management. I will highlight empiric treatments such as smart water bottles and diet supplements. I will describe new uses of old medications, such as the use of potassium or sodium bicarbonate in patients unable to tolerate or afford potassium citrate. I will focus on medications to reduce urinary oxalate, not only in patients with enteric hyperoxaluria, but for all calcium oxalate stone formers. And finally, I will introduce the diagnostic developments in the genomic diagnosis and genetic therapy of patients with recurrent stones, ultimately, potentially leading to a genetic treatment of patients with monogenic stone disorders.